My name is Terry Brewster, for those of you who I haven't met. I'm the director of the NAMI Basics program and the Parents and Teachers as Allies program, and I'm thrilled to have you here. I'm not going to read you a biography on the gentleman that's about to do the presentation, because many of you know his work. You probably know more about him than I do. You can certainly read about him on the website. I want to tell you a couple of important things about him, but before I do that, I want to tell you my personal feelings about why he's here. When I was writing the NAMI Basics program, several of you, as we are wont to do in NAMI, had given me some really specific marching orders about what to do and what not to do. And I knew I would hear from you loudly if I didn't do those things. So I looked carefully, thought carefully about what to put in the curriculum, and skills building is a big part of all of our NAMI education programs. Communication skills, problem-solving skills, and that becomes especially challenging when you're talking about issues with children and adolescents. Because our neighbors look at us a little differently when our kids are acting out, don't they? So when I started looking at what was out there, I had heard of the book, The Explosive Child, had not read it, had heard of it, but started looking at the work of this man, this psychologist, Dr. Ross Greene, and it really made sense. What he was proposing really made sense. And I've got a fairly decent brain and have these letters after my name, and I read the books and I thought, I've got this. I'm going to introduce the concept in NAMI Basics. Not teach people how to do it, but let them know, here's a good model, go learn more about it. And I went to a training in New Jersey. Anybody here from New Jersey? Okay. I went to train basics teachers in New Jersey. Wonderful group, and this nice lady comes up to me with her best Southern hospitality and says, "You've never heard Dr. Greene speak in person, have you?" And I had not. Got an opportunity to hear him about a year ago in Mississippi, and I immediately went home and started rewriting the collaborative problem-solving section of NAMI Basics. Hearing him personally is different. So I want you to have the opportunity to do that. He graciously agreed to fly down from Boston and do this presentation tonight. Even more graciously agreed to let us tape the presentation so we can use it in some of our future teacher trainings. So I'm thrilled. Dr. Greene is an associate professor of psychiatry at Harvard. He is also the author of The Explosive Child, and most recently a book that really nails the model, the collaborative problem-solving model, for me, made it so clear, Lost at School. And without further ado, I want you to help me welcome Dr. Greene in our NAMI fashion. Welcome, Dr. Greene.
Good evening. You could be out having dinner in Washington, D.C. I'll make this worth your while. Welcome to all of you, and thank you for having me. It's an honor to be here. What I'm going to be talking about tonight in the time that I have is, the model of care that I originated for challenging kids and their families and the folks at school, and the folks who sometimes care for them in inpatient units and residential facilities and juvenile detention facilities. Collaborative problem solving has been implemented in all of those settings with some pretty striking success. My attitude is amazing what can happen when people understand challenging kids really well and apply the interventions that flow from that understanding. And so what I thought I would do here tonight is answer four basic questions. Four basic questions. I think if you got these four basic questions, actually three of them, one of them's not so important. I'm going to be talking about four of them. Three of them are really important. I think if you got these questions nailed, then you understand challenging kids really well, and you have a very good sense for, well, why what often gets done to them doesn't work so well, and why we ought to be doing something different. And that's everywhere. That's homes, schools, inpatient units, residential facilities, therapeutic group homes, juvenile detention facilities, any place challenging kids end up, I think we need to understand them better, and I think we need to apply treatments that flow from that understanding. So you're curious, what are those 4 questions? Here they are. The most important question you can answer about a challenging kid is why. Why are challenging kids challenging? Boy, there's a whole bunch of different answers to the question why. And collaborative problem solving has an answer to the question why. We'll get to it soon. Why is huge. Huge. All else flows from why. Closely related to why, when, as you'll see. When are challenging kids challenging? Why and when are very closely connected to each other. Now, a question that I don't think is very important, but I find that we adults spend a lot of time talking about the next one. What? Well, one of the whats. What do challenging kids do when they're challenging? What do they do? Adults could spend a lot of time talking about what the kid did. But if you're spending a lot of time talking about what the kid did, but you don't have the answer to why and when, I don't think the process is going to move forward. So I'm going to call that the little what. Of course, there's another what, the big what. What are we going to do differently than we're doing now that we understand why and when challenging kids are challenging? So in the next hour and a quarter, I shall be answering those 4 questions. Are you ready? Let's begin our journey toward the answer to the question why, my answer to the question why anyways, by starting with some key themes, the key themes of collaborative problem solving. Key theme number 1, and this, quite frankly, if you remember nothing else from the next hour and a quarter, I hope you remember this key theme. This is the mentality. This is the philosophy of collaborative problem solving. And I've been blown away. You know, at this point, I'm talking in different places throughout the world, and what's blowing me away is that in many places in the world where The Explosive Child and Lost at School have been translated, people are coming up to me and saying, this theme is what really got my head turned around. The theme, the mentality of collaborative problem solving is, kids do well if they can. Now, as I always say, nobody ever falls off their chair at the sight of kids do well if they can. It's only an earth-shattering philosophy if you consider a much more popular alternative, the philosophy that floats around out there called kids do well if they wanna. Now, kids do well if they can, and kids do well if they wanna are 2 completely different philosophies, and they have completely different implications for what you're going to be thinking about this kid and why he's challenging, and what you're going to be doing with him or to him to try to make things better. Let's think about kids do well if they wanna for a second. If you have a kids do well if they wanna mentality, and that's very popular, spend a good part of my waking hours talking people out of kids do well if they wanna. It's like my profession. I'm in the business of talking people out of kids do well if they wanna. If you've got a kids do well if they wanna mentality and you're working with a kid who's not doing well, then the reason you think he's not doing well, by virtue of your mentality, is because he doesn't want to do well. Now, I used to think that way. I haven't thought that way for a very long time. That's because at some point along the way, I started asking myself some very important questions, like, why would any kid not want to do well? Don't all of us do the best we can in the circumstances we find ourselves in? Yes. But the kids do well if they want a mentality has those questions covered with very popular concepts like secondary gain, attention seeking, manipulative, coercive, limit testing, unmotivated. Concepts that used to make a great deal of sense to me, but don't make any sense to me at all anymore. I find, and I finally started doing this, that when you really think about them, They don't make any sense whatsoever. The trick is to think about them. I started thinking about them. And the more I thought about them, the less sense they made. In fact, at this point, in my evolution as a mental health professional and thinker on the topic of why are challenging kids challenging, I have come to the conclusion that kids do well if they wanna is wrong. Flat out dead wrong, and I think it's been a great disservice both to challenging kids and their caregivers. But let's say it's right. I don't think it is, but let's say it is. Even if it's right, it's narrow. Because you see, if you think a kid isn't doing well because he doesn't wanna, I can only think of one thing for you to do. Only one role for an adult to play in the life of a kid who's not doing well. Make him wanna. And how do you make a kid wanna do well? We have the technology. You reward the behaviors you like so that you can see more of them, and you punish the behaviors you don't like so that you will see less of them, and you are now in the business of making a kid wanna do well. I sure do hope you're right. I sure do hope you're right, because if you're wrong, there's an outstanding likelihood that you are in the midst of making things worse. You knew the answer. I didn't get into the helping profession to make things worse. I got into the helping profession, a helping profession. Psychology is not the only helping profession. There are many. Parenting is a helping profession. Education is a helping profession. I got into one of the helping professions to help, and I was finding that my thinking that kids weren't doing well because they didn't want to do well not only wasn't helping, but wasn't making any sense anymore. Proof, by the way, that in our schools in the United States, kids do well if they want to is still very popular. In the United States of America, annually, we expel over 100,000 students a year from our public schools. We dole out 3 million suspensions a year, and I believe that's an underestimate. I believe it's underreported. We dole out countless dozens of millions of detentions every year. And here's a statistic that there's actually research to show is correlated with those first three: 2.6 million. The number of human beings incarcerated in the United States of America. Proof to me that a lot of what we've been thinking about and doing to challenging kids hadn't been working very well. And of course, I don't have a statistic for you on the number of timeouts challenging kids get, but we're talking in the bazillions. Whatever number that is, they get them. They get them more than anybody else gets them. So here's the interesting thing. What the research tells us is that the kids who are accessing the school discipline program, the ones who are getting all those suspensions, detentions, and expulsions, are the ones who benefit from it the least. That's why they're getting so many of them, because it isn't working. If it was working, those rates wouldn't be astronomical. The fact that the rates are astronomical is proof that it's not working. So now what are we going to do? We should be doing something different. We should be doing something different. And that begins with changing our lenses from kids do well if they wanna to kids do well if they can. By the way, if the school discipline program isn't working for the kids who access it the most, that begs an interesting question. Who is it working for? Perhaps the kids who never access it in the first place? No, they're not behaving themselves because of the school discipline program. Why are the kids in our schools behaving themselves? Why are the ones who are behaving themselves? Because they can. Which means we don't have to go into transforming discipline, whether it's in our homes or our schools, with great trepidation. What we're doing now isn't working for the kids who need it the most and isn't needed for the kids who don't need it. Kids do well if they can. Says if this kid could do well, he would do well. If he's not doing well, something must be getting in his way. Your role just changed. Your role in the life of a challenging kid just changed. You've just been transformed. Well, it just got harder, but a heck of a lot more productive. What's your role now? It's harder. Figure out what's getting in his way. Then you can help him. You can't help him if you don't know what's getting in his way. Do you know that that's true in every profession? If the auto mechanic doesn't know what's the matter, he won't know what to fix. If the plumber doesn't know what's the matter, he won't know what to fix. And if we don't start doing a better job of figuring out what's getting in the way for challenging kids, they will continue to do poorly. Figuring out what's getting in the way starts with the belief that if this kid could do well, he would do well. If he's not doing, the biggest favor you can do a challenging kid is to finally at long last be the person who figures out what's been getting in his way. Because you see, if he's still challenging, it's a pretty surefire bet. No one's figured it out yet. The fact that the kid is still challenging is usually proof positive that we haven't done a sufficient job of figuring out what's been getting in his way yet. There's your key theme. If you remember nothing else from the remainder of the talk, remember that kids do well if they can, and that if this kid could do well, he would do well. But just in case you're still listening, key theme number 2. The definition of good parenting, good teaching, and good treatment, it's the same for all three. Being responsive to the hand you've been dealt. Now that's more profound than it at first sounds. Being responsive to the hand you've been dealt doesn't mean treating every kid exactly the same. That's not good parenting. That's not good teaching. That's not good treatment. Good parenting means being responsive to the hand you've been dealt. And if you want to be responsive to the hand you've been dealt, first and foremost, you got to know what's in your hand. Hard to be responsive to it if you don't know what cards you're holding. Same for good treatment. If I walked into a mental health professional's office one day for the first time and the mental health professional looked at me and said, "Don't talk. You don't need to say a word." I give everybody the exact same treatment irrespective of what they need from me. Not good treatment. Good teaching means being responsive in 2 ways. It's hard, I think good teaching, being a responsive teacher, is the hardest of the 3. Good teaching means being responsive not only to the needs of the larger group, but to the needs of each individual within that group, and that is hard. Because it's hard, it sometimes doesn't go very well. Because when it doesn't go very well, human nature kicks in, and human nature says, well, if I can't do both well, I'll do one well. The research tells us classroom teachers are much more oriented toward group outcomes. Mental health professionals are much more oriented toward individual outcomes. So when being responsive in those 2 ways isn't going too well in a school classroom and human nature kicks in, who gets picked most of the time? The group. And who is sacrificed? The individual. My attitude doesn't have to be that way. I see those 2 ways of being responsive in a school classroom as being inextricably linked, inseparable. The things you do to enhance the group sets the stage for the things you're trying to do with individuals. The things you do with individuals enhances your group. I can't separate the 2. But across all 3, if you want to be responsive to the hand you've been dealt, you got to know what's in your hand. Hard to be responsive to it if you don't know what cards you're holding. Key theme number 3. Only 3 key themes, I promise. Then I'll really start talking. Your explanation guides your intervention. How you explain why a child is doing poorly leads you directly to what you're going to do about it. And if your explanation is off base, your intervention will be off base. Off base explanations lead to off base interventions, and off base interventions don't work very well, but it's a very familiar scenario. We adults, in our good intentions, we're in a hurry to fix the problem, the one we don't know that much about yet. We often jump straight into fixing it before we know the first thing about it. And those interventions are doomed. My attitude, how could it be otherwise? I'm always encouraging people, pull back on the reins. Figure out what you got sitting in front of you first. Then you got a better chance of fixing it. Got no chance of fixing it if you're not exactly sure what you're trying to fix. So let's think for a moment, only briefly, about the conventional wisdom explanation for why challenging kids are challenging. Are you ready? Why are challenging kids challenging goes the conventional wisdom, and I'm only bringing this up briefly to talk you out of it. Challenging kids are challenging goes to the conventional wisdom because of passive, permissive, inconsistent, non-contingent parenting, through which the kid learned that his challenging behavior is an effective means of getting something, for example, attention, or escaping or avoiding something, for example, homework. Keyword, learned. And who, according to the conventional wisdom, did the kid learn it from? I already told you. His passive, permissive, inconsistent, non-contingent parents. Where did they go wrong? According to the theory, at around age 2, all children exhibit what are called rudimentary coercive behaviors. Whining, crying. Well, I got 2 kids. They were 2 once. When they were 2, I agree, they whined and they cried. You don't lose me on the whining and crying part. Kids, when they're 2, they whine and cry. Truth is, my 2 kids are 10 and 12 now. Sometimes they still do. In fact, I know adults who still whine and cry. So apparently whining and crying is normative at various points throughout the developmental span. You don't lose me on the whining and crying part. Where do you lose me? When you start referring to those behaviors as rudimentary coercive behaviors? Really? You mean the whining and crying that we'd all agree was developmentally normative at 12 to 18 months has just 6 to 12 short months of development later become the rudimentary coercive behavior of the 24-month-old? Really? Look at what we're making of kids practically from the get-go. Well, according to the theory, if parents are consistent, contingent, do a good job of teaching the child who's boss, those rudimentary coercive behaviors should fade away. On the other hand, according to the theory, if parents are inconsistent, non-contingent, don't do a good job of teaching the child who's boss, those rudimentary coercive behaviors will not only not fade away, they'll get worse. That's the theory. When did I start to wonder about that theory? Because I used to think that way. I started wondering about that theory long time ago. Now, maybe 18, 19 years ago. Now, I've had my degree for 21. Started questioning that way of thinking 18, 19 years ago. You might be wondering, what did he do for those first 2 or 3 years? He assumed he was giving incredible advice, and people just weren't following it very well. After 2 to 3 years of doing that, it suddenly dawned on me, maybe I'm not giving such incredible advice. So I started doing something that I hadn't been doing a whole lot of up until then. I started listening to many of the parents and teachers with whom I was working. And what was one of the things many of the parents were telling me that really got my head turned around once I started listening to it? They were telling me they had other children in their home who were well-behaved. Now, the first few times I heard that, I remember thinking to myself, how'd they do that? If they're passive, permissive, inconsistent, non-contingent parents, how did it come to pass that they have well-behaved children in their home? I started listening more closely. Many of the parents and teachers with whom I was working were telling me that the traditional, we'll put this in quotes, good discipline, that, we'll put this in quotes too, worked for their well-behaved kids simply wasn't working for this one. And no matter how high they ratcheted it up, in many instances, they actually seemed to be making the kid worse. Got me thinking. Got me thinking about what I was thinking. Got me thinking about what I was telling people to do based on what I was thinking. Got me thinking about the word function. These days, the conventional wisdom is that all behavior has function, meaning that the reason the person is exhibiting the behavior is because it's working. How is it working? It's working at getting the kid something he wants, and of course the cliche there is attention, or helping him escape or avoid something, tedious, difficult, challenging, uncomfortable, scary, for example, homework, or going to school, or sleeping in his own bed at night. I've come to call that the first pass definition of function. And as you shall soon hear, I think we need to move on to the second pass. Because number one, the first pass is too narrow. The first pass is too narrow. My observation is that the kid's challenging behavior, when you take the long view, isn't working at all. Isn't working one little bit. Wait a minute, Ross, don't you think he's just acting up so he can get out of English? Maybe. See, it's working for him. No, it's not. Don't you think he'd prefer to be in English doing well just like everybody else? What's getting in the way of him doing well in English? Maybe he is trying to get thrown out, but that's too narrow. Don't we have to move outside of that and figure out what is it about English that isn't working for him? Why can't he do well in that environment? Why is he trying to get himself thrown out? Well, don't you think he's just trying to get himself suspended? Maybe at this point, but what is it about being in this building that isn't working for him, that would set the stage for him to believe that his only course of action is to get himself thrown out? See, here's another very important mantra. Well, our first mantra of the evening, you're going to be getting all the mantras of collaborative problem solving. Our first mantra of the evening, well, it's actually our second. Kids do all if they can is our most important mantra. This is a related mantra. Doing well is always preferable to not doing well, assuming that a kid has the skills to pull it off. He'd prefer to be doing well. And there goes the conventional wisdom telling us that the reason this kid was doing this is because he was getting his jollies this way, or that it's working for him. It isn't working for him. It's clearly not working. He'd prefer to be doing well. Goodbye attention seeking. Goodbye manipulative. Goodbye coercive. Goodbye limit testing. I find these kids don't test any limits, don't test limits any more than the rest of us do. And you can take that from a certified limit tester. To tell you the truth, what I like to test the limits on is people's conceptualizations of why challenging kids are challenging. I like to get people to stretch. I mean, I don't tell anybody but if I'm driving on the Massachusetts Turnpike, I'm probably testing limits. And doing it just well enough to not get pulled over. I don't find that challenging kids test limits any more than the rest of us do. They're limit testers, we're limit testers. And by the way, I believe that the notion that the parents of challenging kids have challenging kids because they're inconsistent, that needs a little work too. My experience is that all of us are inconsistent parents. I've yet to meet the perfectly consistent parent. I've yet to meet the parent who's perfectly consistent with their co-parent, if there is one. I find that parents of challenging kids are inconsistent, but I also find that parents of well-behaved kids are inconsistent too. So apparently, this isn't just about passive, permissive, inconsistent, non-contingent parenting. In fact, in my belief, it's not about that at all. So what other explanation might we have? Well, I'm about to answer the question why. Our first question of the night is about to be answered. Ready? Here's the soundbite. Why are challenging kids challenging? Because they're lacking the skills not to be challenging. If they had the skills to not be challenging, they wouldn't be challenging. How do I know that? Because I know that kids do well if they can. And I know that doing well is preferable to not doing well, but only if you have the skills to pull it off. Well, now that's just a horse of a completely different color. That is just a horse of a completely different color. I cannot tell you the damage that is caused by blaming parents for the challenging behavior of their challenging kids. And I cannot tell you what a relief it is when those parents come across this information. It's not your fault. Your kid is challenging because he's lacking the skills not to be challenging. If he had the skills to not be challenging, he wouldn't be challenging. I know I'm repeating myself. It's worth repeating. Because kids do well if they can, and because doing well is preferable to not doing well, but only if you have the skills to pull it off. We have just moved from blame to understanding. And that is exactly where we should have been, because guess who else does well if they can? Parents. Who else? Teachers. Anybody else? Principals, school psychologists, staff on inpatient units, staff in residential facilities, child psychiatrists, well, it sounds like just about everybody does well if they can. Why are we blaming parents for something most folks aren't very good at either? Understanding and helping challenging kids. Why are challenging kids challenging? Because they're lacking the skills not to be challenging. I'm going to let that settle in. What kind of skills? I'll get to that soon. I think I'll answer when next. Ready for when? I just covered why. Oh, by the way, that answer to the question why, I've come to call that the second pass at determining the function of a kid's challenging behavior. And by the way, according to the second pass, what's the function of a kid's challenging behavior? Not that the behavior is working, but something much more obvious. Challenging behavior simply communicates to us that the kid doesn't have the skills to do it better, because if he could, he would. See, what that tells you is that challenging behavior in kids is a form of developmental delay. It's lagging skills. It's really no different than any other developmental delay. When do kids who have difficulty reading mostly struggle? When you're asking them to read. When do kids with delays in the domains of flexibility, adaptability, frustration tolerance, and problem solving mostly struggle? When the world is demanding those skills. Kids who are having difficulty reading are having difficulty mastering the skills required for being proficient in reading. Kids with social, emotional, and behavioral challenges are having difficulty mastering the skills required for being proficient in handling life's social, emotional, and behavioral challenges. It's a developmental delay. Holy cow. What are those skills again? Well, the umbrella skills: flexibility, adaptability, frustration tolerance, problem solving. I'm always challenging people to think of the last challenging episode they can remember that occurred outside the context of demands for those skills, and no one can ever come up with anything. I started figuring that out 18, 19 years ago. I started paying much closer attention to the specific conditions under which challenging behavior was happening, because the first thing I realized was challenging kids aren't challenging every second of every waking hour. They're challenging sometimes, under some conditions, in some situations. I started paying much closer attention to the situations which challenging kids are challenging, and guess what I noticed? Challenging kids are only challenging when the world is demanding certain skills: flexibility, adaptability, frustration tolerance, problem solving. Now, a long time ago, I'm just putting two and two together. I'm thinking to myself, if the only time challenging kids are challenging and when certain skills are being demanded of them, then it must be they're lacking those skills. Because if they had them, we'd be seeing them. And now our mantras, because kids do well if they can, and because doing well is always preferable to not doing well, but only if you have the skills to pull it off. It's not that the challenging behavior is working. The function of challenging behavior is that it communicates to us that the kid doesn't have the skills to do it better. When you're seeing challenging behavior, you're seeing a kid who's lacking the skills to do it better. Ready for when? You've just gotten a big dose of why. I think you're ready for when. Big question number one has now been answered, and I consider it to be the most important answer. When are challenging kids challenging? I'm going to use my hands for this. Challenging kids are challenging when the demands being placed upon them, I'll call that force number one, exceed the skills they have to respond adaptively to those demands. Force number two, challenging kids are challenging when the clash of the two forces occurs. When the demands being placed upon them exceed the skills that they have to respond adaptively. Just in case you're wondering, when are you challenging? Under the exact same conditions. Here's your soundbite. When do you look bad? When you can't look good. If you could look good, you would look good. Looking good is always preferable to looking bad, but only if you have the skills to pull it off. So this is interesting. If challenging kids are challenging under the exact same conditions in which the rest of us are challenging, then what's the difference between challenging kids and the rest of us? Not much. Well, because they're lacking crucial skills, they're challenging more easily, and therefore more often, and in ways that are more extreme than the rest of us, but that's it. What have we got that they ain't got? Skills. By the way, there's other possible combinations. If the world is demanding skills and a kid has them, the clash of the two forces does not occur. Challenging behavior does not occur. If a kid is lacking skills and the environment is not demanding them at a particular moment, and by the way, that explains why challenging kids aren't challenging every second of every waking hour, because the skills they're lacking aren't being demanded every second of every waking hour. The clash of the two forces does not occur. Challenging behavior does not occur. When does challenging behavior occur? When the demands being placed upon a kid exceed that kid's skills to respond adaptively. It's the clash of the two forces. I've just told you when. Now you know when. Let me give you some examples. Does doing a homework assignment require skills? Yeah. If doing a homework assignment demands skills and a kid is lacking those skills and that's setting in motion challenging behavior, the clash of the two forces has occurred. The likelihood of challenging behavior has been heightened. Does sitting in circle time at school require skills? Yeah, lots of them. If a kid is lacking those skills and the environment is demanding them, and the clash of those two forces is setting in motion challenging behavior, the clash of the two forces has occurred, challenging behavior has occurred. Now you know when. That was easy. But I have another term to introduce you to. This is occurring in each individual kid in highly specific conditions. Conditions specific to that kid. I call those, now some people call those antecedents, some people call them triggers, I used to, but I don't anymore. Some people call them situations, conditions. What do I call them? Unsolved problems. Why do I prefer unsolved problems? Because I'm not exactly sure what to do with an antecedent. I'm not exactly sure what to do with a trigger. But I know exactly what you're supposed to do with an unsolved problem. Unsolved problems are supposed to be solved. Y'all could give this talk for me, couldn't you? What's interesting is, this stuff is kind of obvious, isn't it? So, how come we're still doing a lot of what we're doing to challenging kids? If this stuff is so obvious, how come those rates of detention and suspension and expulsion and those ungodly numbers of timeouts that these kids, and we, by the way, have endured because of the advice of a well-intentioned mental health professional, how come we're still doing that stuff when the answers to these questions are so obvious? So, circle time would be an unsolved problem in a kid for whom circle time is setting in motion challenging behavior. A particular homework assignment could be an unsolved problem in the conditions under which, when that's setting in motion challenging behavior. Going to school could be an unsolved problem. Let's think of some other home ones. Teeth brushing could be a popular unsolved problem. amount of time the kid is spending in front of the screen could be an unsolved problem, very popular one. What the kid is choosing to eat and when he's choosing to eat it, very popular unsolved problems. Waking up in the morning, going to bed at night, all very popular unsolved problems. Unsolved problems at home, at school, getting to work on a particular assignment, staying at work on a particular assignment, what the kid's doing in the hallway, what the kid's doing on the bus, what the kid's doing in recess, what the kid's doing at lunch. All typical unsolved problems. Each challenging kid has a pile of unsolved problems sitting right next to him. They're his. And they've been next to him for a long time. And the older he gets, and the longer those unsolved problems remain unsolved, the bigger the pile grows. What's the goal of intervention? Move problems from the unsolved pile, where they're causing challenging behavior, to the solved pile, where they don't. Mark my words, solved problems don't cause challenging behavior. Only unsolved problems do. Why and when? We're done. We're done with why and when. And as far as I'm concerned, the most important part of the talk is over, because why and when are the most important parts. Making sure people are wearing the right lenses when it comes to challenging kids is the most important part. But since I got another 45 minutes, don't forget what I just said, though. Well, I'll remind you at the end. But don't forget what I just said. The most important parts are why and when, because those are your lenses. And yes, I believe that the lenses I've just been talking about are far more accurate, far more compassionate, and far more productive than other lenses we could be wearing. All right, let's talk about the little what. Ready for the little what? What do challenging kids do when they're being challenging? Oh no, I got nothing novel for you there. They're not that original. What do they do when they're looking bad? Here's a full disclosure for you. I'm not a very diagnostically oriented mental health professional. This sometimes rubs people the wrong way. I think you'll understand what I'm saying, though. I'm not that diagnostically oriented. I think that what a diagnosis tells you mostly is about the little whats. A diagnosis mostly tells you what the kid is doing when he's looking bad. So I don't really rely on the DSM to help me understand challenging kids, because to tell you the truth, one of the limits of diagnoses, there's many in fact, and there are advantages to diagnoses too. I'm not dismissing those. I'm just saying that I think that the limits sometimes outweigh the advantages. Well, they help you know that there's something different about your kid. You knew that already. All right, the diagnosis made it official. Diagnoses can help kids access services that they may not have been able to access without the diagnosis. Now, whose idea was that? Whose idea was it that a kid should have to have a diagnosis before he accesses services he needs? That doesn't make any sense. All right, but it is what it is. Diagnoses can help parents not feel so alone if they are with other parents or teachers who have been working with kids with similar diagnoses. One of the biggest downsides of a diagnosis is it doesn't give you any information at all about why and when. Doesn't usually tell you what skills the kid's lacking. And it doesn't tell you when the clash of the two forces is gonna occur. So I'm not too oriented toward diagnoses. I prefer to talk about challenging behavior in the context of what I call the spectrum of looking bad. Things human beings do when they're having trouble looking good. Once again, what do you do when you're having trouble looking good? You do something on the spectrum of looking bad. This applies to adults as well. I'll talk about it purely in the context of children, but what's on the spectrum of looking bad? Well, there's the easy end of the spectrum of looking bad, and there's the extreme end of the spectrum of looking bad. What's at the easy end? Whining, pouting, sulking, withdrawing. Everybody always wants to know where I am on the spectrum of looking bad. I'm a withdrawer. What do I do when the demands being placed upon me exceed my capacity to respond adaptively? I withdraw. I get quiet. My 10-year-old son, who doesn't mind me letting people know this, he's a crier. That's also the easy end of the spectrum of looking bad. What does my 10-year-old son do when the demands being placed upon him exceed his capacity to respond adaptively? He cries. Why does he cry? Because he's a crier. Criers cry. Pouters pout, sulkers sulk. Whiners whine. Withdrawers withdraw. My 12-year-old daughter, who probably does mind me talking about it, but I have her permission, as long as I don't use her name. She's a little further down the spectrum of looking bad. She's a crier screamer. When does my 12-year-old daughter cry and scream? You already know the answer. When the demands being placed upon her exceed her capacity to respond adaptively. Now, more specifically, she actually doesn't cry and scream very often anymore, but she used to cry and scream a lot 2 years ago at 10:30 at night, on weeknights, during the school year. Get where I'm heading here? When the demands of 2 to 3 hours of homework had finally exceeded the skills that she had to respond adaptively, what would she do then? She'd cry and she'd scream. Now, I told you she doesn't do that very often anymore. Why not? Because we solved that problem. Once again, solved problems don't set challenging behavior in motion. Only unsolved problems do. Let's move a little further down the spectrum of looking bad. Who do we find there? And she knows I talk about her too. My wife. She's a screamer swearer. Interesting thing about adults who scream and swear, and my wife doesn't really much care who's around. We're used to it. We just sit around going, there she goes again. My wife was driving my car about a week ago. Where was I? Yeah, it was about a week ago. And on the bridge that goes over into and out of Boston, that big bridge that you see pictures of, the car broke down right in the middle of rush hour traffic. So my wife was petrified, and I asked my daughter, who was in the car with her, the highlight of the story. She said, Mom was dropping F-bombs all over the place. I said, were you scared? No, I had to cover my ears, but I wasn't scared. Here's the interesting thing about being a screamer swearer. If you're an adult, apparently, you can get away with it. But if you're a kid, and you're a screamer swearer, and you're doing that stuff at school, you've now accessed the school discipline program. I sure do hope the folks in the school discipline program understand why you're a screamer swearer, because if they don't, there's an outstanding likelihood that they're going to intervene. Here in the year 2010, given what we know about why and when challenging kids are challenging, there is still an outstanding likelihood that they're going to intervene in ways that push you further down the spectrum of looking bad. What's further down the spectrum of looking bad? You know, this is not novel. Biting, spitting, kicking, hitting, throwing, running, destroying, stealing, lying. Further, behaviors that are injurious to oneself or others. Cutting, self-induced vomiting, drinking to excess, drugging to excess, stabbing, shooting. All on the same spectrum? That's right. All things human beings do when they couldn't think anything else to do. All things human beings do when the demands being placed upon them exceeded their capacity to respond adaptively. I consider myself one of the luckiest mental health professionals on the face of the earth. Because there's a lot of mental health professionals who haven't worked with everything on the spectrum of looking bad. And I have. I'm really lucky. There's very little I haven't seen. But because there's very little I haven't seen, I can make the following statement with some degree of assurance. Irrespective of where a kid falls on the spectrum of looking bad, do you know that I don't see any difference between them? Having now worked with my share of whiners, pouters, sulkers, hitters, spitters, kickers, throwers, destroyers, and everything at the extreme end of the spectrum, do you know that as relates to why and when they're doing what they're doing, I see no difference between them? You can take that from a guy who's worked with the whole spectrum. In fact, just to show you how jaded I am, and I wouldn't say this about every diagnosis, but I would say this about the one that people consider me to be an expert in: oppositional defiant disorder. It's apparently my expertise. How do you know it's your expertise? You get asked to write chapters on it. So apparently it's my expertise. I'm an expert in oppositional defiant disorder. And sometimes I get asked to write chapters on what comes after oppositional defiant disorder, conduct disorder. But the research tells us, which is more akin to juvenile delinquency, but what the research tells us is that every kid with conduct disorder had oppositional defiant disorder first, which means I wouldn't call it conduct disorder. I mean, they haven't asked me, but if they asked me, I wouldn't call it conduct disorder. I'd call it PUTODD, poorly understood and treated oppositional defiant disorder. I think if you understand and treat it well early, you don't see what we see later. I think the reason we see what we see later is because we didn't understand and treat it well early. That's my experience. That's what I've learned in working with challenging kids. So let's really talk about my expertise, oppositional defiant disorder. What does oppositional defiant disorder really tell you about a kid? Where he falls on the spectrum of looking bad. What do kids with oppositional defiant disorder do when the demands being placed upon them exceed their capacity to respond adaptively? They pitch a fit. So here I am, 4 years of grad school, 1 year internship, and 21 years of experience later. What am I an expert in? Fit pitchers. What do fit pitchers do when the demands being placed upon them exceed their capacity to respond adaptively? They pitch a fit. I'm an expert in fit pitchers. But interesting thing I noticed about fit pitchers a long time ago, fit pitchers don't pitch fits every second of every waking hour. They pitch fits sometimes under certain conditions. You know what those conditions are, but now let me ask you an interesting question. What that tells you is that fit pitchers don't pitch fits all the time, which means that at best, or worst, they have what we might call part-time oppositional defiant disorder. Can you have oppositional defiant disorder part-time? Apparently so. Now you got why, when, and the little what. We got it all covered. But here's your mantra. Here's my mantra. These are my lenses. The lenses that I have on and the filter that I have on whenever I'm observing challenging behavior, whenever I'm hearing people telling me about a kid's challenging behavior. What am I hearing? What's my filter? What are my lenses? Behind every challenging behavior is a lagging skill and a demand for that skill. In other words, an unsolved problem. You know, there are many lenses you could wear. You could view challenging behavior through the lens of a diagnosis, and I'm not allergic to doing that. I'm just saying I think that there is more specific information available to us. Lagging skills, unsolved problems. You could view challenging behavior through the prism of passive, permissive, inconsistent, non-contingent parenting. Now you know why I don't. You could say things about challenging kids that would not move you 1 centimeter closer to understanding and helping. In fact, one of the things I find is that we adults often spend a lot of time in our meetings about these kids, whether it's in a school or in a family therapy session or an inpatient unit or a residential facility or prison, we spend a lot of time talking about things that we can do nothing about. We take what we know about the kid and his history, and we point to that as the cause of his challenging behavior, when in fact, all of us had some interesting stuff happen in our lives. Those of us who aren't challenging, people don't point at that stuff. People who are challenging, that's the stuff they point at. So I very commonly hear people say about challenging kids things like, well, you know, he was born prematurely. Nice background information. Thank you very much. First of all, how do you know that's why he's challenging? But perhaps more important, there's a lot of kids who are born prematurely who aren't behaviorally challenging. So how do you know that's what it is? But perhaps more importantly, and I'm a pragmatist at heart, what can you do about it? And if you can't do anything about it, then why are we spending time talking about it? Well, you know, the reason he's challenging is because he was, he was born out of wedlock. I see. Aren't there a lot of kids who are born out of wedlock who aren't behaviorally challenging? And furthermore, what can we do about that? And if we can't do anything about it, then why are we busy talking about it? You know, his parents are divorced. Yeah, so are the parents of many of the well-behaved kids here. How do you know that's what it is? You probably don't. Furthermore, what are you going to do about it? And what, I know I'm repeating myself, but it's worth repeating. We spend so much time talking about things that we can do nothing about. His father's in jail, you know. Got it. You know, his brother was a bad egg too. I'm with you. Have you met his mother? She's crazy. I'm there. Let me tell you something about mothers who look crazy. I've worked with many previously sane human beings who were made to look crazy by a challenging kid that they weren't exactly sure, that they didn't quite understand and weren't quite sure how to deal with. And worse than that, were feeling blamed by people for the kid's challenging behavior. You want the recipe for making somebody look crazy? I just gave it to you. They're no more crazy than the rest of us. Stop blaming parents for the challenging behavior of their kids. That's rule number one. Did you know statisticians call what I've just been talking about, this is getting a little technical, but it's sort of funny, the correlation equals causation error. It's the belief that this thing that you found out about the kid is what caused all of his difficulties. And I'm not saying that all that stuff is completely irrelevant. I'm also telling you, though, it's not causal. Let me give you an example of correlation equals causation. You ready? Did you know that there is a very high correlation between ice cream consumption and boating accidents? Well, there happens to be. Now, which causes which? Is it that people who eat ice cream on boats are distracted and therefore more prone to accidents? Or is it that people who get into boating accidents seek out comfort food like ice cream? Which is it? It's neither. Both increase with warm weather. So let's stop talking about stuff that we don't know is really related. Let's stop talking about stuff we can't do anything about in the first place. And I got an idea here. I think this would move the process forward. Let's get the right lenses on. And in getting the right lenses on, let's start talking about stuff that is, number one, accurate, and number two, actionable. Things we can actually do something about. And what are those things? Lagging skills, demands for those skills, unsolved problems. We good? I'm not done yet. Another mantra. Challenging behaviors about delayed development, not poor motivation. All right, then somebody we still got to explain to me why, in the face of a kid being challenging, there are still so many people who are trying to give the kid the incentive to do well, founded on the belief that the kid didn't want to do well in the first place. Kids do well if they can. If the kid could do well, he would do well. Doing well is always preferable to not doing well, but only if a kid has the skills to pull it off. Challenging behavior is about delayed development, not poor motivation. You are out of the motivation business. He's motivated already. What business are you in now? You're in the problem-solving business. You are in the problem-solving business. You are in the business of helping this kid, working with him, to move problems from the unsolved pile to the solved pile. That's what business you're in. And if we think about what I've already covered, we're doing it because we have the right lenses on. By the way, I should warn you, if you start telling people that they're in a problem-solving business before you tell them about everything I just told you, they won't do it because they won't know why they're supposed to do it. It doesn't make any sense to them. You gotta help people understand that this is about lagging skills, demands for those skills, and unsolved problems to lead them to problem solving. Which means I only got one other thing to talk about: how we solve problems with kids. Because now that we know we're in the problem-solving business, we can talk a little bit about how we usually solve problems with kids, and then we better move on to how I recommend we do it instead, because I'm not too keen on how we usually solve problems with kids. Here we go. But before we talk about that, let me tell you about the 3 ingredients that are always applied in collaborative problem solving. This is sort of the summary of what you've heard so far. These are the 3 ingredients, whether I'm working with parents, educators, or people in restrictive therapeutic facilities. It's the same 3 ingredients. We got to make sure people have the right lenses on. Lagging skills, demands for those skills. My mission in life, besides my 2 kids, is to help people understand why challenging kids are challenging. Ingredient number 2, we got to get organized. We've got to identify the specific unsolved problems that are reliably, and I might add predictably, that's going to come up in a second, setting in motion the kids' challenging episodes. We've got to get organized. If we don't know what problems we're trying to solve, we won't solve them. If we don't specifically identify what's in each kid's pile of unsolved problems, we'll never make a dent in the pile because we don't know what's in the pile in the first place. And then we're going to keep saying stuff about him that's so generic, we won't know what to do with him. How do you organize the effort? How do you get less overwhelmed? You start identifying these specific unsolved problems that are getting in the kid's way. You get organized. And third, you get busy. But not busy doing a whole lot of the stuff that gets done to challenging kids that we don't have a whole lot to show for. You get busy solving problems. And at least indirectly, teaching skills. Yes, I'm skipping a few things here. Here's a cartoon. This doctor's looking at his patient and he's saying, first off, you're not a nut, you're a legume. So long as we're operating at these global levels, global categories, things that are not actionable, we won't help all the challenging kids who need our help. And the reason the book is called Lost at School is because we are still losing kids at an astounding rate. In fact, what I've come to call the kids who we lose in our schools, I call them frequent flyers. These are the kids who are frequently being sent down to the office. Once again, the fact that they are frequently being sent down to the office, the reason they're getting a lot of disciplinary referrals is because all those disciplinary referrals aren't working. That's what all those disciplinary referrals tell us. So my attitude is either we haven't realized that yet, or we're not sure what to do instead. I'm about to tell you what to do instead. I call them frequent flyers. I was talking with an assistant principal at the beginning of this past school year, and he was showing me statistics on the number of disciplinary referrals that had been made to him the year before, and it was thousands. Thousands. He said, this is not okay. I agreed. I mean, if it was working, it would be okay, but the fact that there's thousands tells us it's not working. It's not okay. We got to quit doing it. He then said, but I got another statistic for you. He said, did you know that 75% of those thousands of discipline referrals were accounted for by 20 kids in my building? And there they are, our frequent flyers. So long as we're operating at these global, non-specific categories, so long as we're describing them in many of the ways that we do, we don't help them. We continue doing things that not only don't help, but eventually cause them to believe that no one will ever understand and no productive help will ever be offered. And their parents come to feel the same way. All right. I have 15 minutes left to talk about this. That's pretty cool. I can talk about this in 15 minutes. And then we'll take questions. Sound like a plan? We got this big old pile of unsolved problems. Our goal is to move it from the solved pile, from the unsolved pile, to the solved pile. And there's basically, and this is one of the things that people thought was pretty cool about the explosive child. The explosive child is the first place that I articulated the 3 options for solving problems. But this isn't just your 3 ways of solving problems with kids. It's the way you solve problems with your significant other. Somebody asked me before I started talking if she could do collaborative problem solving with her husband. I said, maybe. I don't know her husband. This is the way adults solve problems with each other, 3 ways. This is the way nations solve problems with each other, 3 ways. I call them Plan A, Plan B, and Plan C. What I've done here is taken the many different ways in which adults solve problems with kids. That's the context I'm going to talk about these 3 options in. I've taken the many ways in which adults solve problems with kids, and I've reduced them to 3 basic options. A, B, C. What I'm sitting here telling you is that if you're solving a problem with a kid, you're either doing A, or you're doing B, or you're doing C. And which is the most popular one that people could be doing? A. Plan A is when you're using unilateral problem solving, sometimes known as imposition of adult will. Now, that's pretty popular. Most of us in this room were raised on Plan A. And a lot of people who were raised on Plan A think they turned out just fine. Of course, I don't spend a whole lot of time talking in front of people who are in jail. So no wonder most of the people I'm talking to think they turned out just fine in response to Plan A. When people see, I'm about to tell you why I wouldn't do Plan A. I'm about to try to talk you out of Plan A. And what I get when I start trying to talk people out of Plan A is I get them saying to me, why are you trying to talk us out of Plan A? I turned out fine. I'm delighted that you turned out fine. Ecstatic. Apparently, if you turned out fine, you were what we might call a Plan A responder. But the kids I work with, they're the Plan A non-responders. So when people ask me, what's the downside to Plan A? I tell them, well, it depends on whether you're a Plan A responder or a Plan A non-responder. Truth is, there's a downside to Plan A, even in Plan A responders. But let me talk about the Plan A non-responders first, because that's really where the model came from. My work with Plan A non-responders. What's the downside to Plan A in a Plan A non-responder? Simple. Plan A causes challenging behavior in challenging kids. Why? What just happened? You just threw Plan A at a kid who doesn't have a Plan A brain. Why doesn't he have a Plan A brain? Because having will imposed upon you, something most of us in this room don't like very much, requires skills to handle well. Skills like flexibility, adaptability, frustration tolerance, problem solving. You throw plan A at a kid who doesn't have the skills to handle plan A, the clash of the two forces has just occurred, and he's about to do something on the spectrum of looking bad. Do plan A on a spitter, what's he going to do? He's going to spit. You do plan A with a hitter, what's he going to do? Hit. Isn't this is pretty obvious stuff, isn't it? You throw plan A at a kid who doesn't have the skills to handle plan A, he's gonna blow. I'm talking about the plan A non-responders. Now an interesting little question. Who gets more plan A thrown at them than any other type of kid? The challenging ones, the ones least equipped to handle it well. Now whose idea was that? Well, I gotta tell you, that idea goes way back. I've been researching this. That idea goes way back. My attitude, we've learned a lot about challenging kids in the last 30 years. It's time for what we do to help them to be much more of a reflection of what we now know about them. So it doesn't really matter to me what we used to do. It matters to me what we ought to be doing now that we know what we know about why and when challenging kids are challenging. I don't long for the good old days. We didn't have the research we now have. In the good old days, we got it now. Good. Let's use it to proceed with our challenging kids in a way that is far more enlightened than what they are presently getting from us in a lot of places. Well, now you know the downside of doing Plan A with a challenging kid. Want to know the downside of doing Plan A with a regular old kid, a Plan A responder? Well, and this is a little more philosophical, because the Plan A responders, they got the skills to deal with Plan A. They don't like it. They can't understand why you're doing it when they know there's another way that you could be doing it, but they got the skills to deal. Just don't lose sight of the fact that if you're doing a lot of Plan A on a regular old kid, a Plan A responder, you're teaching perpetual lessons on the might makes right principle. Now, I didn't know this all the way along, but I know it now. I've been around long enough to now fully appreciate that might does not make right. And it's caused me to ponder why we would be busy teaching kids that it does make right when it doesn't. I'm talking about the Plan A responders here. I don't really want to find out if a kid is a Plan A responder. It doesn't make any sense to me with them either. Plan B is when you're solving problems in a completely different way. Plan B is when you're solving problems collaboratively. And Plan C, you're not solving the problem at all. Plan C is when you're dropping the expectation or unsolved problem completely, at least for now. Now, many people hear that and they think, giving in? No, I didn't say giving in. Dropping it completely, at least for now. Giving in, the definition of giving in is when you start with Plan A and end up capitulating because the kid made your life miserable. That's giving in. But the C of Plan C doesn't stand for capitulating. If it was the right letter, it would be Plan P, prioritizing. Remember, we got this big pile of unsolved problems. We're not going to be able to solve them all at once. We're going to be able to solve 2 or 3 of them at a time. What are we going to do with the rest of them? We're going to get them off the burner completely so that the space is cleared, the smoke is cleared to work on the 2 or 3 that we've decided we're working on first. When will we start to work on some of the ones that were in Plan C? When we get some solved with Plan B. I spend most of my waking hours helping people do B. Much more B, some C, and less A. So what's B? 3 ingredients. 3 ingredients. Here's the 3 ingredients of doing Plan B. And fair warning, don't say I didn't tell you. It's hard. It's really, really hard. And one of the things I spend an enormous amount of time and energy doing is try to making it easier. So that's why the website that I'm going to give you at the end of the talk has all kinds of streaming video on it showing you what Plan B looks like when it's done well, when it's done poorly. More video is being shot all the time in my never-ending quest to make these three ingredients more doable. But no matter what, it's hard, because most of us haven't had a whole lot of practice at solving problems collaboratively. These are the three ingredients: the empathy step, the define the problem step, and the invitation step. Now, I don't have time to go into great detail here, but let me tell you what the ingredients of each step are, and then I'll tell you a funny story, and then we'll stop. Sound like a plan? I've grown not to love what I named the steps. I think the model has evolved beyond the names of the three steps. The names I gave them a very long time ago. Empathy, in other words, isn't actually the main ingredient of the empathy step, and that's not me saying I don't think challenging kids are deserving of our empathy. They are deserving of our empathy. It's just that empathy isn't the main ingredient of the empathy step. What's the main ingredient of the empathy step? Information gathering and understanding. Gathering information about and understanding what? The kid's concern or perspective on the unsolved problem you're talking with them about right now, preferably proactively. See, why should you wait until you're back in the thick of an unsolved problem that you already knew was coming? Because you've made a list. You've made a list of the unsolved problems that are reliably and predictably setting in motion the kid's challenge. Reliably and predictably? Wait a minute. Challenging behavior is predictable? Yes, sirree. Challenging behavior is predictable. In each kid, it occurs with the clash of the two forces, and in each kid, that's specific unsolved problems. One of the biggest favors you can do yourself and your challenging kid is to make a list of the highly specific unsolved problems that are setting in motion his challenging behavior, because that sets the stage for you to, number one, prioritize what are we working on right now, and number two, to start solving those problems before they come up again. The main ingredient of the empathy step is information gathering and understanding. Understanding the kid's concern or perspective on a given unsolved problem. The define the problem step. Now, I called it that because in collaborative problem solving, a problem is defined simply as two concerns that have yet to be reconciled, the kid's and yours, his first. Why his first? Because if you put your concern on the table first, he's going to think you're doing plan A. His first, then yours. I promise your concern will not only be heard, it will be addressed. In the define the problem step, we're getting your concern on the table. What do we have on the table now? Two concerns. How many solutions do we have on the table? None. How could you be thinking of solutions yet without knowing what the concerns are of both parties? You can't. And yet, we adults do. We adults, I find, are solution machines. You give an adult just a smidget of information on a given unsolved problem and watch the adult kick in with 57 different ways to solve that problem that isn't even well understood yet. No, the score at the end of the define the problem step is 2-0. Concerns 2. Solutions, nothing. When do you start talking about solutions? In the invitation. Now, I called it that because I liked the idea of when you're collaborating with somebody, you invite them to solve the problem with you. But what ingredient would I say is the main ingredient of that step at this point? Brainstorming. Brainstorming solutions. Solutions, well, a highly specialized type of solution. Solutions that are realistic, meaning both parties can do what they're agreeing to do, and mutually satisfactory, meaning the concerns that we put all that energy into getting on the table in those first two steps, the concerns of both parties will be addressed. That's collaborative problem solving. It's hard, but you want to see hard? do plan A with a challenging kid and watch what he does. That's harder. My attitude, these 3 ingredients, worth getting good at, and the way to get problems from the unsolved pile to the solved pile and keep them there, while simultaneously reducing the likelihood of challenging behavior. A causes challenging behavior, B doesn't usually. And simultaneously, teaching the kid the skills he's lacking. The vast majority of skills that kids are lacking are taught through use of these 3 ingredients. I actually don't do an enormous amount of direct skills training. Most of the skills training I do is indirect. Do these 3 ingredients help kids become more flexible and adaptable? Yeah. Deal better with frustration? Yeah. Learn how to solve problems? Yep. As John Mayer would say in that tune he does, check, check, check. Ready for a funny story for me to end the talk? Let me just give you a bit of a sense for what this looks like. Don't read that slide. I've told this story sometimes. As part of my usual first meeting with a kid and his or her parents, I usually spend the first half hour to a 45-minute with the adult caregivers, and then the kid's out of the room. And what am I asking the adult caregivers about? Well, you know, lagging skills, demands for those skills, unsolved problems. I'm getting a picture of who this kid is that I've never met. After 45 minutes, out go the adults, in comes the kid. And I've already got a bit of a sense for what's walking in the door, but now I want to see it with my own eyes. I usually ask these kids if they can, on this particular day, the day that this story is about, into my office on this particular day walks a 4-year-old girl. And from what I had heard in the past 45 minutes from her single mom, the single part's not the most important part, of course, things were nasty. It's ugly at home. This kid's got a lot of lagging skills, and they got a lot of unsolved problems they got to get busy solving. As part of my usual conversation with these kids, I like to ask them if they can think of anything that caused a big blowout between them and their parents in the last week. So I said to her, can you think of anything that caused a big blowout between you and your mom in the last week? She said, yes. First thing I noticed, very serious kid. I said, what? What caused a big blowout between you and your mom in the last week? She said, my mom poked a hole in my chicken pot pie. Now you need to know something about me. I've worked with way too many of these kids. It's only really 2 things that turn me on about them anymore: seeing them get better and novelty. And back then, this was 9 or 10 years ago, I'd never heard of a kid losing it over having a hole poked in a chicken pot pie before. So I'm on the edge of my seat. I'd never heard of it. But I was telling this story for the first time in Charlotte, North Carolina. It was memorable. 9 or 10 years ago, and a woman starts cracking up in the audience. And I stopped and I said, what's so funny? She said, I hate having holes poked in my chicken pot pie too. Back to the little girl. I said, your mom poked a hole in your chicken pot pie. Why'd she do that? She said she wanted to make sure it wasn't too hot for me to eat on the insides. I'm thinking, that's reasonable. We now have the adult concern on the table. And we want to know what I've learned about adults? We have reasonable, legitimate concerns. Of course, there's something missing. The kid's concern. It's got to be 2-0, not 1-0. If we're doing collaborative problem solving, it can't be 1-0. It's got to be 2-0. I said to her, what's the problem with having a hole poked in your chicken pot pie? She got dead serious. Very inflexible, thinking serious. She said, if you poke a hole in the chicken pot pie, the crust gets wet. And the crust is supposed to be crusty. I'm thinking, I never heard of this before. I'm going to be famous. But my friend in Charlotte, North Carolina put the kibosh on that After she told me she hated having holes poked in a chicken pot pie too, I said to her, "You do? What's the problem?" She said, "If you poke a hole in the chicken pot pie, the crust gets wet. The crust is supposed to be crusty." Apparently this is rather common. Now I want to see if this kid can do anything resembling Plan B. I said to her, and this is oversimplified Plan B. I don't want you to get at the idea this is what it usually looks like, because it is usually much longer, and the concerns of both parties require much more exploration than this, but this is a funny story. I said, I just want to see if she can do anything resembling collaborative problem solving, coming up with solutions that address not only her concern, but also somebody else's. What a concept. I said, you want the crust to be crusty. And your mom wants to make sure that your mouth doesn't get burned on the insides. 2-0. We must be ready to start solving the problem now. I said, I wonder if there's a way, this is how the invitation usually starts, I wonder if there's a way for the crust to be crusty and you not to have your mouth get burned on the insides. You got any ideas? And by the way, it's not the kid's job to solve the problem. It's y'all's job to solve the problem. It's just good strategy to give the kid the first shot at solving the problem. Lets the kid know beyond a shadow of a doubt you're actually interested in their ideas. She thought about it. And then she said the following. 4 years old. My mom could get a spatula. She could get the crust of the pot pie off the top. She could lay it on the side. I could eat the crust first, and then by the time I was through eating the crust, the insides would have cooled down enough so my mom wouldn't have to stick her finger in my food. I'm beside myself. I'm thinking the mother has got to hear this. I go running out to the waiting room. The mother sees I've got a big smile on my face. She thinks I've uncovered some deep-rooted psychological issue in just 5 minutes. She comes racing after me back to my office, sits down filled with anticipation and says, "So what y'all been talking about?" I said, "Pot pies." Her face turned gray. She said, we haven't had pot pie since then. I said, well, I think you might be very interested to hear the solution your daughter has come up with to the pot pie problem. I said, go ahead, tell her. Kid told her. Mother's jaw dropped wide open, literally. Why the mother's jaw dropped wide open? She never knew her kid could do this. Why didn't she know her kid could do this? Because she'd been too busy knee-jerking everything into Plan A. What's the moral of the story? Number one, if you're doing Plan A with a challenging kid, your house is now a mess, or your classroom is too. But more important than that, if you're too busy knee-jerking everything into Plan A, you're going to slam the door on Plan B. And Plan B is where the conversation takes place. You get two concerns on the table. The skills get taught, and the problems get solved. And that, ladies and gentlemen, is collaborative problem solving. I am delighted to take a few questions. Does anybody have any? By the way, while you're going to the microphone, if there are any, I told you that I would remind you this. Yes, Plan B is hard to do. Yes, it is worth putting in the practice to get good at it. Just don't forget that why and when are the most important parts. And in your journey toward collaborative problem solving, and yes, this might sound a little grandiose, but I don't think so. I think we're all on the road to collaborative problem solving. Where we are on that road is different for each of us, but if you need any help along the way, this is where I hope you will turn. This is the website of the nonprofit that I have created and that I hope will be working closely with NAMI to be helping collaborative problem solving become the lenses and the way we do things with challenging kids. This website has more stuff on it that you'd be able to get to in 2 days. Apparently the average time that people spend on the website is 6 minutes, which tells me that the information is actually completely overwhelming for people. I'm working on doing something about that. But if you are deeply invested in learning more about collaborative problem solving, that's your homework. Go to that website.